Welcome to the Vibrantly You podcast. We're your hosts, Megan Martineau
and Caitlin Cipriano. In this podcast, we talk about fitness and nutrition on your motherhood journey. Whether you are trying to conceive, pregnant, postpartum, or beyond, you are welcome here.
Nothing is off limits, and our goal is to support you in this important season of life so that you can feel vibrantly you. As a reminder, this information is not medical advice. Please see the show notes for more details. Welcome back to the Vibrantly You podcast. Today we have a special guest episode featuring Dr. Courtney Smiach from Rebel PT in Fuquay-Varina, North Carolina. Courtney is a doctor of physical therapy and specializes in orthopedics and pelvic floor therapy. She opened her own clinic because she's passionate about providing a safe space for women where they feel comfortable opening up about their symptoms and concerns and being able to provide the highest quality of care to get to the root of the problem. Today, we are going to be talking with her about what you can expect at a pelvic floor physical therapy appointment, as well as the pros and cons of insurance versus cash-based clinics. So, Courtney, on behalf of Caitlin and I, welcome to the podcast. Do you want to share a little bit? Do you want to share a little bit more about why you decided to specialize in pelvic floor therapy in addition to orthopedics, since that's what we're going to be talking about today?
Yeah, absolutely. I will try to. I know we're on a time limit today, so try to keep that story short. It could be a long one, but I mean, bottom line was I started out in orthopedics, thought I was going to be the sports ortho PT that a lot of us get into that career path for. You know, when we're playing sports or we have injuries in high school, it kind of piques our interest. Typically, that's sort of the most common path. And I started out in that, was really happy. But as I started treating, especially more women with hip pain, things like hip impingement, labral tears within the hip, just sorts of things in that realm around the pelvis, even chronic low back pain. There was just a lot of people who you would get 80% better and they kept coming back for the same thing. So maybe 6 months later, a year later, it's the same kind of cycle for them. And I was like, what's the missing piece here? So then some personal health problems popped up that led me to see a pelvic PT. And that's when my brain connected the dots to say, there's things that we're not seeing, right, from the ortho brain kind of standpoint or a thought process. And then there are pelvic PTs who aren't seeing that link with ortho too. So there's a lot of crossover, as you know, Megan. We've learned a lot together. So that was really why. I was like seeing that gap of why are we not getting people 100% better, and realizing that there's a lot of connection between everything else around the pelvis and the pelvic floor too. So I just took that first class, kind of ripped the Band-Aid off, felt it out, and really fell in love with it, actually.
So for someone though, Megan and I are, have similar backgrounds, but for someone who has never maybe been to pelvic floor PT or isn't that familiar, can you walk us through like what they might expect or what that appointment typically could look like?
Yeah. I feel like, especially if someone's seeking care for pelvic floor symptoms, like we said, it's a little bit uncomfortable, or people feel a little bit shameful about it, So I feel like a lot of us in the field and fitness related fields or pregnancy and postpartum fields, we're trying to normalize that, right? And even just in general as women, like we all, pregnant or not pregnant, kids, no kids, can have pelvic floor dysfunction. So it's about feeling comfortable to come in, like you said, Megan, in the intro, which is why I started my practice, to make it really cozy and comfortable and kind of homey for people to feel comfortable coming to. But it's really not as scary as it sounds. The first, typically an appointment's about an hour for that evaluation. And the first 15 to 20 minutes is just talking. So us asking the patient questions about their medical history, what symptoms do they have going on. A lot of that conversation helps us to get to know them, but also helps us to start problem solving what might be going on. And that is the most important part of the exam, actually. Getting to spend time hearing people's stories really tells us everything we need to know. And our testing that follows is really like the cherry on top to kind of tell us for sure that, yep, our thought process is right or wrong and how to proceed. So then it might be a little bit of testing. So running through the orthopedic screen if the PT feels it's related to their symptoms. So checking out their range of motion, their low back mobility, maybe their hip mobility, hip strength, all the muscles around the hips and low back usually are involved in a pelvic PT assessment. And then there is an internal piece. So that is really important that if the patient feels comfortable, it's never a forced thing. It's always put on the table as an option, but we are trained with extra training to do a pelvic floor internal examination vaginally. So it could be rectally as well, depending on your PT's training. But that part is really telling us about what their pelvic floor is doing. So, do they have weakness in their muscles? Are they lacking endurance? Do they have something like prolapse? Do we see something changing in their anatomy that could be causing their symptoms, or even a lot of tension in their pelvic floor, which is really common? So, that would be really the first half. And then, based on what we find, going over a treatment plan and options for them, which could be exercise based, a little bit of hands on therapy, or a mix of the two, and kind of starting to set a plan together with them.
Yeah, I think so many people are afraid of pelvic PT because they think they're just like walking in and dropping their pants. So I think it's great, even that you said
Yes.
that like the internal piece can be really helpful to kind of troubleshoot and figure out what's going on, but that it is also optional and people don't have to do
Yeah.
that.
Yeah. And it absolutely doesn't have to fall on session one. Sometimes we do the ortho piece first and splice it up, give them time to, if they weren't prepared for that mentally, that's a thing, to sit on it. And maybe session two or three, you kind of confirm what you're thinking is going on with that exam. Or others, I get the opposite. They're like, nope, I want it today. I know this is a thing. I have to know what's going on, especially if they're stressed about something, especially prolapse, which is a whole other topic probably that we don't have time for. But if someone is dealing with that, it's kind of scary. And they're like, no, I need to know what's going on. So it could go either way. And it's just about meeting the patient where they are.
And I
Yeah.
think that was great that you touched on that, like meeting the individual where they're at, because I think that that is where a lot of fear can come when you're looking to like get introduced to a new service
Yeah.
provider.
Yeah.
And so being able to, like you said, really spend time like building the relationship and understanding where they're coming from is
Yeah.
awesome.
Yeah.
So I'm going rogue though on something that you said with a question. Can you tell people about the difference between having weakness in their pelvic floor versus having a tight pelvic floor? Because a lot of people I don't think realize that they can have issues from having tight pelvic floor.
Yeah. Yeah. Actually, I think that's a big stigma that I think pelvic PTs, fitness trainers, anybody in this space, for especially pregnancy and postpartum, but even just people who have pelvic pain, are trying to raise awareness for. I'd say this is just a total ballpark guess, but I would say 70 to 80% of patients coming in with pelvic floor dysfunction actually have tension in their pelvic floor, which that's the importance of the internal exam, because there's symptoms that we can pinpoint that are suggesting tension versus weakness, but there is also crossover. And it really is important to know which side the patient is on, because it's going to change treatment. Almost everybody needs strengthening, but if we miss the tension piece in the beginning, let's say we think somebody just has weakness and they actually have a tight pelvic floor, and we start strengthening, it could make their symptoms worse, or it might be why they're not getting better. They might need a time frame of some breathing exercises, teaching them how to stretch their own pelvic floor mobility to kind of restore like that range of motion in the pelvic floor muscles so that it can get stronger and function better. So there is an important component to that of knowing what is happening so that treatment can be really specific for the patient.
Did you have any follow-ups, Caitlin, with that?
No.
Before we move on. Okay.
No, I just was, I think that, I just wanted her to touch on that piece because I don't think a lot of people know that. I didn't know that
Yeah.
initially.
It's the Kegel thing, right?
Yeah.
Everybody wants to do Kegels or thinks they have to do Kegels or told that over decades, but it could be making someone worse if they have a tighter pelvic floor. So I see that more commonly, that people actually need the down training and the relaxation first.
So I think that's a good segue into pregnancy because I feel like in pregnancy, people think they need to do a ton of Kegels because I do think there's a misconception where people think their pelvic floor pushes the baby out. It does not. The uterus does.
Yeah.
But
Yep.
this is a big
Mhm.
misconception and something a lot of people are like I remember when I was pregnant with my son and I didn't have any awareness, about the pelvic floor at the time. And I had friends who had babies before me. And I remember someone telling me, oh, make sure you do your Kegels throughout pregnancy so that your pelvic floor is nice and strong for birth. And in my head, I'm like, yeah, that makes sense. Obviously, knowing what I know now, I'm like, oh, that was horrible advice. Um, but how would you treat, someone who comes in who is pregnant, who maybe is experiencing like leaking already or just any sort of like pelvic pain? I also think people think more of pelvic PT as like a postpartum thing, but like what are common things that you treat people with who are pregnant?
Yeah, yeah. I think I try to explain, like we always say that we do birth prep, right? And postpartum care, but I always explain it exactly like you said. There's just different levels to that. Like if you just kind of keep it simple and say that someone's feeling great, they're not having any pain during pregnancy, everything's going pretty smoothly for them, like status quo, right? Like in pregnancy, we want just like status quo. We don't want anything crazy, right, thrown at us. So if everything's going pretty routine, if they wanted to come in, that's exactly what we would do is maybe around 20 to 25 weeks, assess them, like I just said earlier, find out what their body is doing or not doing well with, and then we start prepping them for birth prep for delivery. So can they relax their pelvic floor well? Can we work on breathing and pressure management techniques so that they're confident with their pushing, work on hip mobility, anything that could just limit them getting into comfortably a laboring position, just making sure as much as available to them as possible, feels good. We don't have pain limiting them. And in those positions, they can control their pelvic floor. So you're right. It is about balance between having enough strength to not be leaking or having symptoms, but also have enough control that they can override that resting tone in the muscles to push well and relax. Because you're right. And that was news to me too. I mean, we for decades just been told this thing about Kegels and pushing the baby out, being strong, but it's actually about now that we've learned more over the last 15 to 20 years and pelvic PTs on the rise and other OTs get into it too. Um, it is really about like getting the pelvic floor out of the way, letting the uterus do its job and learning how to manage our pressure so we can reduce the extra pressure on the pelvic floor as much as possible during labor. So that's what kind of birth prep could look like. Now, it might be a little different if someone is having pain at any stage of pregnancy. If it's before that point, they're welcome to come in sooner. And then we just treat it like a normal patient who's not pregnant coming in. We're just going to address their pain and try to get them feeling as good as possible. And then we might like integrate that whole birth prep program with their other treatment for their pain. Um, if that makes sense. Is there anything else did I miss in that question?
No, that makes sense. And I think going to PT for birth prep is awesome. And again, I think it's something that people don't even know that that's something that they can do because yeah, like you don't know really how to push, right? Or like what you're supposed to do in labor because there's really no
Yeah,
way to practice it until you're in it. And so
right.
I do think there's so much value in being able to go to physical therapy, understand what's going on with your pelvic floor, learning how to coordinate those muscles and the pressure management, like you said, so that you can hopefully have a better birth experience.
Right. And like you said, I mean, it's easy for us even in practice to do well, but when you're in that moment, I mean, I've never had a child, so I mean, I've had we'll say kidney stones where you're in that type of pain level of like, I can't really think straight right now. Like it's kind of out of body. We kind of lose that control over what's happening. So it is really good for them. More repetition, the brain starts to learn those patterns. It's like they have some control and know what to expect before they're in that situation where it's a little stressful, it's chaotic, they're in pain. A lot of decisions are happening if they're in the hospital and, things are just happening, right? So it's good for that muscle memory. So they can kind of rely on that if even they feel less focused on it. And even if they have a support partner with them or a doula, it's like a big collaborative effort between all of those birth support people for them in the room that they can learn this info too and remind the birthing mom what is going, what they need to do or what their options are even for pain management during delivery, we will dip into that a little bit as part of birth prep too.
Yeah, I think that's awesome. I think it should be something that everybody does when they're pregnant. Part of their like add that on to childbirth ed classes, go to pelvic PT for birth prep.
Right, right.
Yeah, I was just thinking as you said that too, like, how great would that be if someone, obviously they have their regular child birth prep experience that's a little bit more traditional, but now they actually have someone else that can understand it in a little bit different light so that like what's really like going on and how you can move your body to be like assistive during that time because it is very like out of body experience, and if you don't have that like
Yeah,
muscle memory
yeah,
connection experience
yeah,
before, like
yeah,
it
yeah.
is very difficult and challenging.
Yeah. And I'll just highlight real quick that birth prep is so specialized. Like there are moms that come in and say, I know I want an epidural, like non-negotiable, I'm getting one. So we'll tweak it to adapt to that. There are still ways to benefit from education and planning, whether or they want to try to go natural or even the C-section. If they know that there's a chance or they are having a planned C-section, we just adapt everything to that. There's still ways to support, even if we're not having, when we think of that like a natural vaginal birth, there are other ways to still support moms throughout however they want that path to go, or it may be taking a turn that they weren't expecting. So I think it's important to note like birth prep could be the standard we think of is what we talked about first, but it could be adapted to any type of delivery.
Yeah, I love that. And it's just really individualized, which is
Yeah.
what we all need. So, would you
Yeah.
say, like, even just like anecdotally speaking, but like, would you say that there are better outcomes for people who start pelvic floor therapy in pregnancy when it comes to like common issues we think about postpartum, like diastasis recti or prolapse? Like, can we
Yeah.
prevent these things in any way? Like, what does the evidence say? Like, what has your experience been anecdotally?
Yeah, I think there's not, it's so hard, like with anything during pregnancy or even pelvic floor, it's hard to quantify. Like it's not like with like a knee, we know quad strength and range of motion and things to study, right? It's like you're subjecting yourself to a lot of assessments if you were to join a research study. And it's like with pregnancy, nobody wants to study things during pregnancy if there is a posed risk, right? So we don't have a ton of research on a lot of things. But like you said, clinically, I would say after, let's see, I've been a PT in year 8 now, and then year 5 of start getting into pelvic PT. I would say that clinically and anecdotally, I do see a big difference. Even if someone is struggling a lot with sickness during their pregnancy and not maybe exercising like they were before, want to be, if they're doing even a little bit goes a long way for postpartum. Like if at a bare minimum, we are walking if we can, working on mobility, like thoracic in the hips, and just doing a little bit of core strength and stability. No matter how crazy or difficult the delivery goes, I see those moms feeling so much better postpartum. Like when we check up with them 2 or 3 weeks post or at their 6-ish week checkup, I just see their ability to reconnect with their muscles be so much faster because of that muscle memory, right? Like the nervous system remembers and they've laid that neural connection. Even if the muscles have lost strength, they can reconnect so much faster. So it's not perfect. I can't ever promise that that's going to be the case. And there are certain things like diastasis recti that are very genetic and will happen to almost everybody after 36 weeks. So I can't promise that it would prevent that or that we're going to prevent prolapse. But I can say that the patients that did a little bit of birth prep are just having a much easier recovery typically, or they tell me they're feeling so much better. Or if they've had, maybe this was baby 2 or 3 and they didn't have birth prep or PT before with their first, they will say that this was so much better than the last time. So I think there is something to be said about that. So maybe not as far as prevention, but I will say with prolapse, I just see again people not having worsening prolapse. So if anything, if it's not getting maybe better, it's like not worsening. like it could with a vaginal delivery being a risk factor for it happening or getting worse. If they're doing a little bit of strengthening or working on pressure management, proper pushing, they're coming back and I'm like, this is great. Your prolapse actually didn't get worse. So that's awesome. So that's just clinically what I'm seeing. Um, so that's what I've found for sure.
Yeah, I love that. So just another case for why everyone should go to PT when they're pregnant.
I think it's
Yeah.
also a good
Even
case
if
to,
they're not. Yeah. Oh no, I was just gonna say if you're just like thinking about having kids, it never hurts just to come in and get a screen. Because like I'm a pelvic PT myself, I'm sure my pelvic floor is not as strong as it should be right now. So
I think it's a good case to say too that not every single thing has to have like a quantifiable study or be like, gold standard evidence based. Like we can see things as practitioners that are working clinically really well for the patients that we're seeing. And like you say, just, be able to say like, objectively, like they're feeling better by doing this thing, and that's still worth like noting and mentioning to
yeah,
people.
yeah. I feel like they say that in school too, in the medical professions. Like we see those Venn diagrams of like our evidence and our knowledge, but that expert opinion still is there because we're seeing patterns over and over again. So it's a little scary, but I mean, I remember I'm like not artsy or creative at all. And I remember being scared by that in school when our professor would say, there's an art to physical therapy and art to exactly like you said, see things over time and start kind of solving those problems. But once you start gaining more clinical experience and treating more people, it's easy to see those patterns. And like you said, they might not be ones that we can measure really well. So just trusting expertise along the way is
Yeah.
hard for us to trust our gut, but also collaboration. I'd say pelvic PTs talk a lot more than like ortho PTs, maybe, at least from my past experience. So we're constantly like, what are you seeing? What works for these types of patients? Like just sharing that knowledge as much as we can.
I think that's important. I mean, it's important in these types of professions to be collaborative with one another. I think especially in women's health because there isn't as many bodies
Yeah,
of research, and so being able to talk amongst other providers to get it out to women and to have this
yeah,
information so they can make empowered
yeah.
decisions. So I think this is a good like transition in our talk. We wanted to also discuss with you this the model of like insurance versus cash-based care. And so can you
Mhm.
explain to our audience the difference between seeing a pelvic floor PT through insurance versus going the cash-based route?
Yeah, I think I'm trying to think about the best way to highlight it. I would say, is there really a change in the practitioner, like the PT that you're seeing? Most likely not, but the system that they're in and what maybe freedom they have to do certain things versus not could look different. So, if we just started with like in network, people typically think go to PT, go to wherever place takes my insurance, right? Pelvic PTs have we treat a wide variety of things, especially outside of pregnancy and postpartum too. So you might just go to a place that takes your insurance, and that pelvic therapist might have a ton of training with birth prep and postpartum, or they might have a ton of training with patients with chronic pelvic pain. So they might do it all, or they might have a very niche with their skills and what they've been exposed to. So you're just sometimes you're not sure who you're going to see or what their niche is or their skill set. And we should be able to treat a wide variety of things, but you just might not know a lot about the therapist and who they are, what their specialties are. So you're kind of just subject to whatever that clinic has, if they have pelvic PT at all. And in network, just as far as limitations, sometimes different states it varies. We have a lot of freedom with direct access in North Carolina as PTs to treat what you come to us with, and we can evaluate and treat, right? But others, some insurances might say, oh, you can only do one body part at a time, or else we won't cover it. So if we have a patient who's got SI pain and leaking and back pain, we're in a weird pickle as a therapist to be like, well, what do we code and how do we bill it so that it gets covered for the patient? So we are a little bit dictated with what we can do by their insurance, unfortunately. Um, Biggest thing to be aware of is this is the good transition point. If you think we all are learning about how to navigate healthcare, right? Even me working in it. Um, if people have a high deductible, I feel like they're the ones that get caught in the middle where they have maybe a $4,000 deductible. I'm going to use mine for an example. $4,000, that's my deductible. If I go to anywhere, any practitioner, my PCP, OBGYN, my a PT, for example, I will pay everything for the year up until that $4,000 hit. My in-network benefits do not kick in until that's met. So that can get people in a pickle where they think, I'm going to go in network, it's covered. And that's true, but deductibles can throw what that coverage looks like for a loop. So they might think they're covered and not pay a dime for 3 months of treatment. And then 6 months later, all those bills balance in the background, contracts between Blue Cross Blue Shield or United or whoever you have with that company or that clinic. And then boom, you're like, why did I just get billed for $3,000? That's about understanding your insurance. That's just the best way I can explain it. So then if you were to go to a cash PT, the opposite might be true. You're probably picking them because your doctor's maybe not referring you to them as often. You might scope them out on social media or your friend went to see them. So you kind of have to find out who they are as a person. What's their specialty? Does it fit what you need? Are they the right PT for you? And then it's full transparency. So I can say, like, I have a pricing as if you went to your hairdresser or you went to get a massage or your nails done, except no, we cannot accept tip and we wouldn't anyway. It's medical. But like, you'd be like, oh, this is the price per hour, per visit, or whatever that PT offers. And that's what I'm going to pay. We have the freedom to really, because insurance isn't telling us what to code or what to do, really just treat you and really spend sometimes more time with you. Visits might be shorter in network versus we have a little more time to listen and be specific in cash-based medicine. We still can help you by giving you that coded bill, giving your insurance everything they want to hear, what they want to see, and break it down. And then you just have to submit that super bill to your insurance. Coverage is going to vary again, depending on deductibles, your coverage, but it absolutely still can be involved in the process to get reimbursed. So it's just that billing process that looks different, but the level of care could vary. Some in-network clinics are outstanding. Others, it depends on what they're under. Every business is different. And reimbursement for therapy just keeps dropping every year. So that's why you're going to see in-network clinics starting to like have 30-minute visits or 40-minute visits or evals that are 40 minutes. And that's really hard for pelvic to like get to know the patient, not rush and make sure they feel comfortable, and then even do a pelvic exam. It's almost impossible in under an hour to do it well. So that's kind of the big difference. That's a lot, but it's medicine's in a tough spot right now.
Okay, so I think one thing that also makes people want to go to insurance based is that they're thinking about that like kind of traditional PT model, right? Where you're going like 2, 3 times a week, and then they're like looking at the cash based prices and they're like, oh my gosh, I can't afford, that price 3 times a week. But I know from experience, because Dr. Courtney was also my physical therapist, and I went to like a more traditional clinic postpartum as well. But so I know from personal experience that typically you're going less frequently when you pick a cash-based provider. So can you talk about why that is? Like why typically you don't have to see patients as frequently?
Yeah, there's a few things, and part of me wants to almost like shield the raw answer, but we're gonna rip the Band-Aid off. I mean, again, if we go back to like, and it's not trashing, it's just the system, right? If we go back to like reimbursement keeps going down for whatever therapy codes and whatnot. So like they're a business too, right? And they're like, how do I make money? So that's why I had to get out, because there were instances where your managers or your higher ups in the company, a more corporate PT business, right, or hospital system, they might say, we have productivity, we have quotas to make, right? They would be like, all of your evals need to be booked for like 2 to 3 follow-ups a week after. And I'm like, but that's not what they need though. Some do, right? Some patients absolutely post-op, whatever, need that. But especially with pelvic PT, They typically don't because it's usually strengthening and mobility and it takes time. Like it takes time for you guys to do the program and then get ready for the next progressions or whatever it is. So it's just that there's like a little bit of corporate pressure to like book your patients more often because it's like this external pressure and it's a business model. Like I totally respect that. I get it, but it's not what the patient always needs. So if you're in the system as a therapist, you're kind of in that like, but this is what I think is actually clinically right for this patient versus what the business wants. And you're kind of stuck in the middle, whether you're going to put your foot down or not. Number two, because of that same reason, appointments might be shorter. So you might get 30, 45 minutes if you're lucky with your patient and actually need to see them more to accomplish the same amount that we can in a solid hour. So I feel like that is the difference. And that is a conversation that I have to have because people think, oh my gosh, like I couldn't afford that. So people on average come to us 2, maybe 3 times a month max when they're getting started, especially if they have pain to manage along the way. But it is very much so about let's cover as much as we can together without rushing, of course. Give you as much as you can with a portal or whatever to do outside of your session. Start holding you accountable with that, lifestyle change or those goals. And then when we see each other again, we're kind of ready to move to the next step together. So it is just a much less frequent, which is good for moms too, because everybody's busy. They don't want to come and I don't want them to feel like they have to handle a schedule that's already overflowing. So it is just different because of the time we have to spend with people.
Yeah, that's a good point. Like for moms, they can't go as frequently. And I even remember that when I was postpartum with my daughter, having to go like twice a week because that was what they wanted me to do at the place that I was going. And I was like, I have 2 kids at home. One's a baby exclusively breastfeeding. Like, how do I keep this
Right.
up? And I even know too, like that place where I first went postpartum. I had already hit my deductible, right, from like delivery and everything. So I was just like, whatever, I'll just go. I didn't
Mhm.
actually have to pay for it. Um, but something that I found so interesting was I really liked my therapist, but she was often seeing like me and somebody else, or even like 2 other people, and she had to like rotate between us. I was often seeing a tech. And again, when I was dealing
Yeah.
with things like prolapse and just, like awkward things to talk about with strangers.
Right.
Like I didn't love like just being kind of shuffled around or just like lost in the
Right.
in the room. Whereas when I went to see you, it was
Yeah.
just so nice where it was like private, like it was just us, like you weren't rushing around. I didn't feel like, oh, I'm over here doing this thing by myself. Am I even doing it right? So, like personally,
Yeah.
I prefer it because I think it's just a better experience.
Yeah. There's a difference between orthopedics and like that is the exact example of how companies are handling the drastic changes with insurance not paying well and trying to stay afloat. And I won't justify it for orthopedics either because I just believe like one-on-one care is the best if we can give it to patients. But it's much different when you're dealing with like a shoulder patient and a low back pain patient with some tech that has exercise experience. Like it's a totally different thing to manage that as a therapist and a patient when you're kind of like having fun in the gym together versus pelvic. It is a very intimate, private thing that I think deserves to be like that. And there's a lot of orthopedic clinics that are like trying to add pelvic in. And I think it has good intentions, but it doesn't fit the same business model. So if the company can't allow like a private space and that therapist to be at least one-on-one for maybe shorter visits, it's kind of like a disservice to the patient at that point. It's just not like nobody needs to be out in a gym talking about, right, like I have pain with intercourse or I'm peeing my pants, but like it's just not comfortable, you know? So
Yeah, exactly. It's just a little awkward.
those would be some red flags if patients are like looking for good care, good pelvic PT or occupational therapy. Like, what are things I don't want to experience? That would be like, you're probably going to get better and you might be okay. But also, if you hit your deductible, that's when actually those out of network benefits might kick in for
True.
reimbursement. So it's like weighing those options and what can you afford? Like, everybody's situation is different. So that might be the best that people can afford. But if you are not feeling good about it and exploring other options, don't let the cash based like model scare you away.
Yeah, and I know that your clinic and even others, but typically most of these cash-based providers will accept HSA, FSA funds too,
Hmm.
right? If people have
Yeah.
that.
Yeah. Yeah, absolutely. You'll see different models. Some will offer packages and want kind of like a lump sum up front. There's pros and cons to both. We just do session to session. So you're going to see some different models too. So you might even have to find a cash-based provider that you like their whole model from the payment plan to however that is to the treatment style. Others will be more orthopedic than others. Some might be more fitness forward. So you can even be really picky with your cash-based provider to make sure it's a really good fit for you.
I think you did a really nice job highlighting what some of the like pros and co both cons from like a systemic issue that's seen in like physical therapy space and other providers
Yeah.
too.
Yeah.
I think just to make sure we like wrap up this conversation like nicely, are there just some things that you see kind of like currently in this space that you want to shed some light on or information around for our audience before we wrap up today?
Yeah. I'm trying to think what would be like a good way to put that all together. I think the biggest thing is just understanding, like if I had to like recap in 3 points, I'm like understanding your insurance and what your options might be. Um, if you are going to go the cash-based route, obviously be picky. Like make sure that you are finding the person that matches your goals because everybody's a little bit different, even down to their personality, right? And how they're going to be with their treating you. Like be picky. Like it's okay to interview us as the therapist and make sure it's a perfect fit and feels good, like the perfect way to spend your money because we value your time and money as well and know that it's important. And life is hard right now for all of us financially. So like be picky, interview that therapist, make sure that they are the right fit for you. And they should also say, let me make sure I'm the best PT for you. If not, they should help you find the right fit. Trying to think number three, I would say just be cautious out there because there's a lot of people who I think saw the rise of popularity in pelvic health and kind of jumped into it, but they might not be in it for the right reasons. And the only red flag I can see is if clinics are advertising pelvic PT or health therapy and they don't have PTs trained to do an internal exam, that's like a red flag. Again, it's not that you always have to do it, but it should be an option available because there's a lot of clinics looking to like make money off of this growth and popularity, and their PTs aren't properly trained to maybe give you the best care. So I would say if you're finding a PT, a good question is like, can they do a pelvic floor exam internally or not? And if they say no, again, we're playing that guessing game of like what the heck's going on with the pelvic floor. If you're going to spend your time and money, right, getting care, make sure that like they have all the options available, or that might just be a red flag to keep looking. So shop around, find the right fit for you, be a little picky, but that would be my biggest question, whether it's in or out of network to ask so that they can give you everything, the best that a pelvic PT can, essentially.
Yeah, I think those are great and really helpful as people try to navigate this system, try to get the best care for them. So yeah, you gave us some really great stuff in this episode, just learning more about like what to expect at pelvic floor PT, why it can be helpful in pregnancy and postpartum, and then just those differences between insurance and cash based. So if people want to find you either online or come see you in person, how do they go about doing that?
Yeah, Instagram's probably where I'm mostly active. I don't have a TikTok. I'm not cool like you guys over there. I probably should have gotten onto it at some point, but it's like too late now. But yeah, I don't know if you guys tag it in the show notes or anything, but
Yeah, we
yeah,
will.
rebel.pt is our main tag. We are located in Fuquay-Varina, North Carolina, so just south of Raleigh. So depending on like what you're looking for, physically we have locations in that area, but we also do telehealth, which unfortunately role wise is limited to North Carolina, but we have had patients in more rural areas where they don't have access to pelvic PT. So we can absolutely do virtual as well. Um, and our website, of course. But yeah, that's where you find us.
Okay, awesome. Well, thanks so much, Dr. Courtney, for joining us today. We really appreciated it. And yeah, we'll drop all of those links in the show notes for people. If you found this episode helpful, be sure to share it with a friend, leave us a review, and we will be back next week.